Hello and welcome to this episode of the ASHA podcast. I'm Fred Wine with the American Sexual Health Association, ASHA, and today we're talking about Native Americans and sexual health with an emphasis on sexually transmitted infections, STIs. With any group, conversations on these topics can always come around to a discussion of culture, social norms, expectations, a lot of things. But there's really a great deal we can explore when talking about Native Americans because you have so much diversity within these communities, and also the important aspect of tribal sovereignty, which I'm really looking forward to chatting about with our guest. So let me introduce our experts from the National Indian Health Board. We're talking with Lacey Wind, NIHB's Public Health Policy and Programs Director, and Marzette, one of the board's public health managers who's worked on STI prevention programs with tribal communities. Lacey and Dree, thank you so much for joining us and welcome.
Thank you. We're excited to be here.
We're excited to have you. And before we get into the crux of it, tell me a little something about the National Indian Health Board. What does the board do?
Yeah, so we were established in 1972 by the tribal leaders who believed that tribes should have a national voice. So our mission is that we are established by the tribes for the tribes to advocate for the united voice of federally recognized American Indian and Alaska Native tribes. We seek to reinforce tribal sovereignty, strengthen tribal health systems, secure resources, and build capacity to achieve the highest level of health and well-being. We are a nonprofit, and we serve all 574 federally recognized tribes.
You serve 574. That is amazing. It sounds like you've got a big job. Well, I thank you for taking time away from all that to chat with me today. So let's just dive right in. I want to talk first about sexually transmitted infections, STIs, looking at 2023 STI surveillance data from CDC, the Centers for Disease Control and Prevention. We see that compared to the US as a whole, Native Americans have higher rates of HIV and a lot of other STDs like chlamydia, gonorrhea, and syphilis. And the gaps are especially wide when you compare them to the rates for white communities. And we should note there's some good news. STI rates in 2023 tended to be down or at least stable across just about every group. And Native Americans and Alaska Natives had the greatest 5-year decrease in rates of reported gonorrhea among any group. But the numbers are still high and the disparities are nagging. And just real quick, and I'll stop the monologue, we should note that higher STI rates in vulnerable communities don't stem from any different behaviors or anything that they're really doing per se. It really has to do with the environment and factors like poverty, lack of access to health care. So with that in mind, what are the challenges faced by Native communities when it comes to STI prevention, including any that might be unique, say, compared to the U.S. more broadly?
Sure. So, Fred, thanks for that question. That's a very awesome question. I think one of the major challenges that we have here in Indian country is sometimes just a lack of knowledge. Knowing a lot of people just don't understand that about 50% of people with syphilis will have no symptoms, or their symptoms are going to be mild and go unnoticed. When I think of an example just off the top of my head, I think about the tribes, many of the tribes in South Dakota. Native Americans make up less than 10% of the population there, but they account for 80% of the state syphilis cases. And as you just talked about that CDC data, we know the rate of syphilis in the Great Plains has surged nearly over 1,800%. And so when you talk about the health disparities, we have to remember that a lot of STI risk is shaped by that a lot of interconnected factors. You touched on poverty, you touched on limited access to care, but I also want to touch on experiences of physical and sexual violence, the maternal care deserts, mental health challenges, the lack of community programs that are available to Native youth. All of those things also add to the challenges that Native communities face when it comes to STI prevention, especially in states where it's not always easy to get access to a test, or you don't know where you can get access to a test, or condoms, especially in states where the health departments have been impacted by federal cuts that now have taken a lot of those funds that was used for STI education has now vanished. It's been moved to other priorities that the health department deemed necessary. And so it's a lot of factors to consider. And then provider trust.
Yes.
Is a huge barrier where there's been a long history of mistreatment and broken promises by both government and health institutions, which is why Great Plains tribal leaders and their tribal health professionals have been consistently calling for the federal government to declare syphilis a public health emergency.
Okay, so you're really segueing to my next question. What do you think we need to do to really address these challenges and work on these numbers?
We need to emphasize that anyone that's sexually active is at risk. And we also need a systemic approach. We need more investment into our rural healthcare infrastructure. How many times have we heard about people saying that a lot of physicians are stretched thin and they just can't get to the different clinics? Telehealth, bandwidth. A lot of our rural areas don't have the ability to be able to take advantage of telehealth because they don't usually have internet access. So all of that is important. Addressing sexually transmitted infections in Native communities is going to require more than just clinical care. It's going to require understanding of Native history, culture, traditions, those socioeconomic factors, understanding the holistic approaches of how those communities operate, how they serve, taking a good look at the data, the gaps in the data, how we can have more data sharing agreements across organizations and health departments and providers to get the most relevant data so that we can deploy the best resources when needed. If there's an outbreak or we are seeing an increase in cases by a certain zip code, we have to strengthen the Indian health system by expanding our workforce and scaling up tools like at-home testing and partner treatment. It's not going to be a one solution fits all, because no tribal community is the same, and not all approaches are going to work, because you have to consider people, and every community is going to have that individual behavior that they're going to have to consider, in addition to their capacity and what resources are readily available or can be made available to those individuals most in need.
You touched on so much there, but one thing really stood out. You mentioned at-home test. CDC, whenever they release these surveillance reports, they always talk about things we need to do a better job of meeting people where they are, going to them rather than just letting them come to us. And this idea of at-home test is one way that I think that the field is kind of is looking at that people can actually take literally tests at home, as the name says, rather than having to go to a clinic. And also things like maybe mobile clinics, or just getting out into the community and just thinking of non-traditional venues to provide services for people. I think that's it exactly. And I just, when you mentioned at-home testing, that's where my mind went. So thank you for bringing that.
And let me just throw this in there. I'm just gonna, because we work very closely with the Indian Health Service. You can visit any Indian Health Service facility or contact your tribal health department. You can check their websites or call, and they more than likely will have tests available for you. The I Want the Kit offers free STI testing kits for people in Arizona and Baltimore. I Know Mine provide free testing kits and educational materials to Native youth in Alaska. And just Eastern Band of Cherokee Indians have a syringe service program where they also provide free testing kits, as well as offer free harm reduction services.
So let me ask, if you were going to give some quick tips around STIs to the Native communities you serve, just like here, 2, 3, or whatever things I really want to get across to you, what would that be?
Use condoms every time. Condoms are one of the best ways to reduce your risk of getting and spreading STIs. Even if you trust your sneaky link, or your friend. Remember that many STIs don't show symptoms. So use condoms every time. It's okay. The best sex is the safe sex. Lil Wayne said it best. And he got an Academy Award for that album. So we can trust Lil Wayne there. Also, learn about sexual health and how it affects your community. Understanding what STIs are, how HIV can be spread, can help you make better informed choices, in my opinion. It can also protect yourself and others. When more people in the community are educated, then more people will be healthier. And then I will also say another quick tip is, if you don't know, call the Indian Health Service.
There you
Like,
go.
you can always call your local healthcare provider, the nurse, the front desk. Just let them know, I don't know. And it's okay to admit, I don't know. I don't know everything. And so when you have a concern, especially about something that is so intimate, and this can affect your whole life. And a lot of people, they find out they may have an STI, not knowing that you can just go get a shot and you'll be okay. And then that can have mental challenges that can happen. So just, if you don't know, call the Indian Health Service. They will know, and they can direct you to the next best place to go.
All right, and we will put some links to resources like that in the show notes. Thank you for that, Dree.
Yes, sir.
All right, let's get a little bit into culture and society. So I want to quote something I saw on the board's website, and I referenced it in the introduction. At NIHB, our approach to public health in Indian country is rooted in respect for tribal sovereignty and the belief that culture is a powerful source of healing. And that struck me because, we think of healing, a lot of times I do, is it's an exam table, it's a blood test, it's a pill, it's a vaccine, but of course there's a whole lot more to it. So why are culture and sovereignty so important to public health in Native communities?
Yeah, so we do think of healing through a clinical lens, right? When Western culture, we really think about doctor visits, lab tests, prescriptions. But in Native communities, we really don't compartmentalize like Western culture does. So healing is more of restoring balance, identities, connections, and you can't really separate those. And so tribal sovereignty really means that because of these different viewpoints, we really need those sovereignty within the tribe so that they can really decide what is best for them and design those programs around what their culture looks like. And again, when we think about NIHB, we serve 574 tribes. All of those tribes have different language, a different culture, a different ways of being. And so we can't say one size fits all. And we know that that doesn't work. So we really need that sovereignty piece so that they can make the choices appropriate for them. And we know that respecting sovereignty is where true healing, education, all of those pieces come from.
And there again, you're talking about meeting people where they are, giving them what they need, a tailored approach. Like you said, I love that. Let me ask you this. Whenever we talk about sexual health care and STIs, it always at some point seems to come around to a discussion about shame, stigma, downright embarrassment about talking about sex and those kinds of things. Would you speak to what this is like in Native communities?
Sure. So when we think again, kind of up to the question before, when we think about colonization, right? True kind of a buzzword, but really what that did was it disrupted our traditional healings and our traditional healings about how we think about sex, what our responsibility is, what our health looks like. We kind of disrupted those stories, those coming of age ceremonies, really understanding our taboos. All of those pieces start from a young age of really thinking about that interconnectedness, right? And so when you disrupt those pieces, you disrupt the education, the responsibility, and the understanding of things like sexual health. So we as Native people, we really don't think of shame as how we get people to do things, right? How we get people to behave right, how we get people to be healthy. Shame isn't really an approach that we use. So when we kind of have that shame culture and those stigma pieces, we don't get the help that we need. We don't get the testing that we need. And again, that's why you really have to think about sovereignty, because if our community is being led by something that we didn't understand or we don't do or we don't believe in, that creates stigma, right? And so you don't want to go see a provider that possibly doesn't understand those pieces. So solution community driven is really important. Trauma informed for our providers. It's really not up to our patients to teach our providers about what we believe in and how we believe it. It's really about cultural safety. So our providers should know that. And so when they communicate those things in sensitive topics like sexuality, they know themselves how to do that. And that should be in a facility wide. If you are in a border town, if you are in a urban Indian setting or an Indian health setting, we really should have those teachings about what individual culture you might see, because that's the provider's responsibility. And that really creates less shame. Also, we have a lot of locums or people not from those hospitals and those clinics. And so you have the trust issue. You may see the provider 2 months and then you don't see a provider again for another 2 months. So you get different providers and over, and that creates that stigma and that shame piece, right? So really trying to think about how we can streamline those providers, create trust. A lot of colonization has created distrust within the healthcare system. So not only do you see a different provider, you also possibly didn't trust the healthcare system ever, right? And so all of those pieces you have to think about to really think about also that stigma piece.
Yeah, that makes sense. Yeah, trust is such an important part of seeking and getting good health care. And you mentioned that we know shame can interfere even with going for your screening, your tests and things. And there's data on that shows that people sometimes, even when they understand that a test or a screening is important, sometimes they still don't schedule just because it's just hard.
Mm-hmm.
And so you're exactly right. All right, last question. If you could sit down with a group of non-Native Americans and say, look, here's what I want you to know about our communities. So pay attention. What would you say?
Well, people probably get tired of me saying this because I think I said this in every one of your questions, right? Is that Native American people are all different, diverse in culture, in governance, in language, in health beliefs. And so I think that is always the starting point to never assume, right? Also, to make that even more complicated because of assimilation, that some people don't, they practice a different religion than their native religion. Some people maybe don't know their culture at all. So also not to make an assumption, and those being your starting points. Also, when we kind of talked about with the other questions too, health isn't just physical in our minds, in our tribal communities. It's spiritual, it's emotional, it's relational, it's all interconnected, that when you're really in balance, that means that you're healthy. So it's not kind of, again, where Western culture is compartmentalized, right? So that we can easily study it, we can collect data. We don't really think that way. We think health is all of those things in one. And so you have to treat all of those things at the same time. Again, you know, we've had centuries of broken promises, underfunded. Those pieces have really created a disadvantage in resources and health outcomes, created systematic barriers. Also, STI is really driven by grants, right? So you have a starting point and you have a ending point. You have certain deliverables to to meet, and where that really, when we think about Western culture of really taking things in compartmental. And so really funding through grants is really a disadvantage, especially in something like STI. The last time is what we talked about and the other questions too, really about tribal sovereignty and understanding that tribes and tribal communities know best. And the more that tribal communities do it their way, communicate it their way, people are going to be safer and healthier.
You know, as I was listening to you, it's so frustrating because we have all these challenges and barriers, and ultimately STIs are largely preventable. It's certainly very manageable in most cases. And we've got all this stuff that we're just not addressing as well as we could. It's one of the lines I've used over the years is we have the means to do better, just do we have the will?
Right.
But when I talk to two people like you, I can see that you've got the will, and I can't thank you enough. Your passion is infectious here. So thank you for sharing that, as well as all of your insights. We've been talking with Lacey Wind and Marzette with the National Indian Health Board. I mean, I learned a lot, and hopefully this will be a way for us to get the conversation started about Native Americans and sexual health and overall health. I know there's a lot more we can get into, but thank you for getting us started with this. And we will link to your organization in the show notes. And dear listeners, check this out. They have a lot of good information there. It's a really, really great website. So thank you both, Lacey and Dree. You're awesome. I appreciate you so much.
Thank you.
And thank you, intrepid listeners, for joining us as always. Keep in touch. We're at info@ashesexualhealth.org. Send along any comments. If you got any topics you want us to cover, let us know. And we'll see you next time. Goodbye, everybody.